At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Good afternoon, everybody. Hello, and welcome to another episode of MedsPLUS Medical Minute, where we bring you trusted health information to help you succeed on your journey to wellness. My name is Dr. Pauline, co-founder of MedsPLUS Consulting, and today we're going to talk about a concept that many people have never heard of, but it's become extremely important in medicine. It's called Cardio-Kidney-Metabolic syndrome, or CKM for short. Now, it may sound like a complicated term, but the idea is actually very simple. Your heart, your kidneys, and your metabolism are all connected. And when one of these systems becomes unhealthy, it affects the others. Now, doctors and researchers are now using the term CKM syndrome to describe the interaction between conditions like obesity, diabetes, kidney disease, and heart disease. And I think that's something important to note here, because we've heard about these conditions for decades. Doctors have been treating and counseling patients on these for decades. But I think understanding the way they're interacted, the way that they're connected, is very important. So understanding this connection helps healthcare professionals identify risk earlier and prevent serious complications. So today I want to help you understand what CKM syndrome is, why it matters, and what you can do to protect your health. First, let's talk about why this topic is so important. In the United States, millions of people are affected by this condition that falls into the CKM category. More than 38 million Americans have diabetes. Over 40% of adults are obese. And about 35 million Americans are living with chronic kidney disease. The truth is, many people have 2 or even 3 of these conditions at the same time. And when these conditions occur together, the risk of heart attack, stroke, heart failure, and kidney failure increases dramatically. That's why healthcare professionals are starting to move away from treating these diseases individually, and instead we are looking at the whole picture. Because the truth is, your body does not operate in silos. Every system is connected. So let's talk about how these conditions are linked. Think of cardiometabolic kidney disorder as a domino effect. For example, someone may begin with excess weight or obesity. Over time, that can lead to insulin resistance, which makes it harder for the body to control blood sugar. Eventually, that may progress to prediabetes or type 2 diabetes. High blood sugar and inflammation can damage your blood vessels and your organs. That damage can lead to high blood pressure and kidney disease. As the heart works harder to compensate, the risk of heart disease and heart failure increases. This is why doctors are now thinking about these conditions as part of a larger system rather than separate diseases. To help identify risk earlier, experts have developed stages of CKM syndrome. There are 5 stages, starting with people who have risk factors and progressing to those with established cardiovascular disease. So let's take a moment and briefly walk through these steps. Stage 0 is when someone has no major risk factors. So their blood, their weight, their blood pressure, their blood sugar are all within healthy ranges. Stage 1 occurs when someone begins to develop excess body fat or metabolic changes. This might include being overweight or obese or having prediabetes. And as we said before, there are millions of Americans who are now in stage 2 CKM, and many of them are not aware of it. So stage 2, again, is when metabolic risk factors occur. And these risk factors can include high blood pressure, diabetes, high triglycerides, or early kidney disease. At this stage, intervention becomes extremely important because we can still prevent serious complications. Stage 3 involves subclinical cardiovascular disease. This means that damage to the heart or blood vessels may already be occurring, even if the person doesn't have symptoms yet. And finally, stage 4 is when someone develops clinical cardiovascular disease, such as a heart attack, stroke, or heart failure. The goal in healthcare is to identify people as early as possible, ideally in stage 1 or 2, before serious complications occur. The good news is that CKM syndrome is largely preventable and manageable. And y'all know at MedsPLUS, we are always talking about healthcare prevention. How do we prevent these chronic diseases? And if you have the chronic disease, how do we prevent the progression to complications? That is our number one goal in doing this outreach and helping communities. Many of the same strategies that protect your heart also protect your kidneys and your metabolism. And we've talked about these before. They include maintaining a healthy weight, being physically active, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, such as fish and chicken, managing your blood pressure, keeping your blood sugar under control, avoiding tobacco, and getting exercise. Now, healthcare providers are also recommending medications when appropriate. For example, newer medications for diabetes and weight management, such as GLP-1s and SGLT2 inhibitors, have shown to provide benefit not only for blood sugar control, but also for heart and kidney protection. And I think that's something very important to note here and to emphasize is that these medications, particularly the GLP-1s, are not just for weight loss. We know that people who are overweight or obese are at increased risk of CKM. So when you take a CKM or a medication such as an SGLT2 inhibitor or a GLP-1 like Wegovy, like Zepbound, you're not just taking it to lose weight, you're taking it to decrease your likelihood of developing a more serious stage of CKM syndrome. This is another example of medicine evolving to treat the whole system rather than just the condition. So what should you do as a patient? We get that all the time. One of the most important things you can do is know your numbers. How many times have y'all seen us either on MedsPLUS Medical Minute or in the community saying know your numbers? This includes knowing your blood pressure, having a blood pressure meter at home, checking your blood pressure regularly. You want to know your numbers. You want to know your blood sugar or your A1C. And again, just as a reminder, the A1C is an average of your blood sugars over the last 60 to 90 days. So if your doctor is checking your A1C, you need to know what that number is, and you need to compare that to your A1C from your last doctor's visit. If you've not gotten A1C in the last 3 to 6 months, either contact your doctor to schedule an appointment, or you can contact MedsPLUS and we can perform the A1C test here for you in our office. So you want to know your blood pressure, you want to know your blood sugar or your A1C, and you want to know your cholesterol levels and your kidney function and your body weight. All of these numbers work together to determine what stage of cardio-metabolic kidney syndrome you may be in, if any. So it lets you know whether you're at risk, and regular screenings are one of the most powerful tools that we have for prevention. I'll say it again, know your numbers. Here at MedsPLUS Pharmacy and Wellness Center, that is exactly the type of work we focus on. We provide services that help address the entire cardio-kidney-metabolic spectrum. That includes blood pressure monitoring, diabetes education, medication management, wellness consultations, and preventive health screenings. Because when we help patients manage one condition, we're often help protect several organ systems at the same time. So if you remember just one thing from today's episode, remember this: your heart health, kidney health, and metabolic health are deeply connected. Taking steps to improve one area can improve them all. Prevention, early detection, and consistent management make a tremendous difference in long-term health. Thank you so much for joining us for today's MedsPLUS Medical Minute. We will see you next week. And if you have any questions about anything I've discussed today, or if you'd like help understanding your numbers, reviewing your medications, or learning more about the ways to improve your health, connect with us here at MedsPLUS Pharmacy and Wellness Center. And if you found this information helpful, please like, share, and follow our page and follow it in our community so you can stay informed. We are dedicated to giving you the information you need to succeed on your wellness journey. We'll see you next week, and I hope everybody has an amazing week. Bye for now.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.